Be empowered. Be strong. Take charge. Speak life. Live life abundantly. Get with it now. You are now entering the chat room. Health Chat with Coach Jean, that is, where we debate, debunk, educate, empower, impart, and raise awareness on all things related to health, healing, and holistic well-being, body, mind, and spirit. Let's go.
Hey, let's go. What's up, everybody? Welcome back to another week. Welcome back to the chat room, everybody. Health Chat with Coach Jean Turner, that is. Look, you already know this is where we debate, debunk, educate, empower, and bring awareness to all things related to health, healing, and holistic well-being, body, mind, soul, and spirit. Thank you so much for joining us here in the chat room. And as always, all thanks and glory and honor goes to God himself for this opportunity to serve. You know, I just enjoy what I do, coming before you, my listening audience, every week. So for wherever you may be here within the United States and around the world, look, thank you so much for joining me for another episode here in the chat room. And so, you know, we've been pounded here in the States with this Hurricane Ida. It's been causing some damage, wreaking havoc, you know, in the Southeast. And then last night and today up in my native home, New York City, and up there north where Batman and the Positive Power XXI family are. So I am praying for all of you, keeping you in my prayers. This too shall pass. And we just trust and believe God that this too shall pass. And so if you know me, you've been listening to Coach Jean for any length of time, you know I'm not a political person, right? Politics ain't my thing. You know, as a nurse and as a minister and an ambassador of Christ, I just love people. I care about people, and therefore I care about the health and well-being of all people. And that, therefore, you know, that's why I do what I do. And, you know, it's sad to say that it took this pandemic to bring to the forefront what many of us in healthcare and in the health industry have already known. And that is that there are disparities, there are inequities, there is inequality in healthcare that's been in existence way before I was born. You know, it exists within our communities, and not just here in the United States, but it is a global issue. And in the words of the prophet, the late, great Dr. Martin Luther King Jr., injustice anywhere is a threat to justice everywhere. And injustice is just another word for inequity and unfairness. And so this brings me to our topic for this week, for this week's episode of Health Chat with Coach Jean. And so I believe firmly that all human beings have the right to receive the same exact resources and opportunities to obtain the same health outcomes as the next person. I don't care what race, what color, what creed, what religion, ethnicity, all of that, okay? Health equity recognizes that we are all different. We have different circumstances. But look, we must get to where in this nation and globally that we are all receiving the exact same resources and opportunities so that we all can reach an equal outcome, right? And so people want to confuse health equalities and health equities, but the difference between the two is the outcome. The outcome is what differentiates between the two. And so not to confuse you, but I tend to use the words inequities and disparities interchangeably. And so I just wanted to throw that out there because I don't want to confuse you. But hey, let's talk about it. So my guest tonight is here. And let's go ahead and pray before we get it popping. My bad. Most gracious Father, in the name of Jesus, we thank you for this gift, this opportunity to share the gift of health, healing, and a holistic approach to wellness with these, your people. And may something shared during this episode bless every listener. We ask that you will forgive us of our sin and cleanse us from all sin and all unrighteousness. Create in us a clean heart and renew a right spirit within us. And may every listener, those who are live streaming, my guest and his family, Jerry Royce and the whole Positive Power 21 family, as well as those who will catch the replay, may we all experience your peace, love, joy, health, healing, and holistic approach and happiness going forward. In your precious son's name, I do ask and pray. Amen, amen, and amen. So I don't know what in the world I think I'm doing and ain't prayed yet. Lord have mercy. But my guest this week, y'all, yes, Mr. Terrence Hight is the founder and CEO of the Hight Effect and Hight Health here in Atlanta, Georgia, USA. He utilizes his years as a healthcare administrator to partner with physicians and other healthcare professionals, as well as community leaders, to provide access, awareness, and education to underserved communities. Just recently, Terrence was featured in Rolling Out magazine, where he shared his passion for a community and specifically the provision of solutions to address social determinants of health. So let's welcome Mr. Terrence Hight to the chat room. What's up, Terrence? Are you in the virtual building, my friend?
Yes, I am. How are you today, Coach Jean, for this evening?
I am good. Thankful that all the rain has passed us, but the Northeast, my family chimed in and said they took a beating from Hurricane Ida, but I am good. Yes. How was your day, my friend?
It was good. I was glad to see some sun out after seeing that rain this week. So it was good. Yeah.
So we blessed. We are so blessed. And so I'm just delighted for you to be joining me as always. Is there anything else you'd like our listeners? This is a worldwide podcast, and we are like all over the nations overseas. Anything you want our global audience to know about you before we continue the conversation?
Hey, the only thing I would say is just stay safe out there. There's so much going on related to health. Just wanting everybody to stay safe because we're all in this together at the end of the day.
That's right. Thank you for saying that, because that's so true, right? We're in the midst of something now that's affecting the world, right? Not just one nation, not just one. Exactly, but affecting everybody. And so let's get it popping, because this discussion right here, I'm very excited about this discussion. This just ignited something in me from when we even had this conversation the other day on social determinants of health. So for you, and based on what you and your company does, Hight Health, how do you define the term social determinants of health? And then let's talk about some examples.
Great question. So the way we define social determinants of health are basically the conditions in which people are born, grow, live, work, and age. So let's talk about that briefly. When you talk about where they're born, are you born somewhere where there are a bunch of parks with dogs running through and birds chirping? Or are you born somewhere where there are maybe gunshots or high violence rates outside? Are you living somewhere where you can get to Whole Foods market, some type of healthy food place, or do you have to go to the local gas station to get your food? And then are you having to walk, or do you have a transportation and a vehicle to get you there? All of those are social determinants of health, and all of those are the things that impact the lifespan, specifically in Black and brown communities. So that's what we're here to help fix, is how do we lengthen that lifespan by addressing these issues.
Yes, and thank you for that definition, because in that definition, you brought up something else. And so what you did cover, yes, the food, access to healthy options, right? It affects our communities. Are we living in a community to where we can go, our kids can go out and play, we can go out and exercise, and do all these things in a safe environment? Or are we hearing gunshots, from sun up to sun down? You know what I'm saying? Economic stability, right? Is there employment? Are people unemployed? Is there even jobs in the community for them to be able to have in order to provide for their families? And so, yes, the transportation to either get back and forth to the job that they have, as well as getting back and forth to healthcare facilities. And so, yes, thank you for that definition. You mentioned, though, and brought up about, you said the lifespan, and then there's health span. And so, for our listeners this evening, those are two terms that I often refer to as well. Lifespan being how long we live in, right? Many people live to be 100, centenarians, our lifespan, how many years we are allowed on this earth. And then health span, regardless of the number of years we live, are we living it at the highest quality of life, at our peak performance, or what I like to call at our maximum wellness capacity, which is very important, especially when we talk about quality of life, right? Because we want to live a good quality of life. We want to be able to raise our kids and enjoy our lives and see grandkids and possibly great-grandkids. And if you're my age, almost 58 years young, I want to be able to still run around with my grandkids and do what I do, right? We don't want to work for years, you know what I'm saying? We don't want to work for decades only to retire, and then we out of breath all the time and ill and sick and can't do nothing. That ain't cool. You know what I'm saying? And so you brought up two very good points there, lifespan and health span. And so, we talked about this too, because people have different opinions and different viewpoints as to what, when we say determinants of health or health inequities refer to. And, here in the United States, I think it's safe to say, Terrence, that the first thing that comes to our mind are the racial disparities or the racial inequities associated with that. But there are others as well, right? I think literacy or the illiteracy of an individual, their behavior, mental health status, their gender identification, because I never say this right, so forgive me, LGBTQ, that, population, there's other factors, that come into play when we talk about these determinants. So what are your thoughts about that?
Yeah, I think that's definitely a great point. And I think now is the time more than ever for these groups to not only be able to come out, to the forefront as being focal points and having criteria that impact your health, but now we need to have care that's delivered in what we're considering a culturally competent way. So it's outside of just, what race you are, but again, gender, what's your gender identification or affiliation, and those different factors. Basically, there are certain needs that we may not even think about. Something as simple as the way a bathroom is in a certain doctor's office. That could be discriminatory in certain cases. So again, I think as time goes on and the world, kind of opens up and gets more interconnected, we'll have these new niche groups, come to the forefront and have care that are designed to take care of them.
Yeah, you know what? That's a good example you gave about the way bathrooms in public places are configured. Are they accessible to the disabled? Because that's another category right there. Add to the other categories that we just talked about, the disabled. Wow. I enjoy our conversation because you bring up a lot of good points that, and even, populations that I either didn't think of or hadn't thought of in a while, which brings me to another population, our veteran population, and I try not to be political, but to be here in the States and one of the superpowers, quote unquote, and we have men and women who have served this country who fit under this category of what we're talking about, the topic tonight, because they don't have access. Now, we have the VA granted, but you know how hard it is to get in the VA, to get an appointment?
Mm-hmm.
It's ridiculous.
Right.
It is ridiculous. It can take several months for one appointment. So, yeah, that's another population, the veteran population as well. And so, you know, for those who might just be tuning into the live stream, we are discussing social determinants of health. And my guest for this episode of Health Chat with Coach G, Mr. Terrence Hight, he is the founder and CEO of Hight Health, and he is joining me this week here in the chat room. And, you know, we cannot have a conversation, I don't believe, surrounding social determinants of health without bringing politics into play. Now, we're familiar with our government, but, you know, because we are a global podcast, we have other nations listening in, and their government might function differently or somewhat the same. But, you know, whether it be through the socioeconomic or the political policies and systems that governments create, they contribute to social determinants. And that also the government greatly impacts the overall health and well-being of societies at large. And this is why voting is so important. The least we can do, it is our civil duty to vote. What are your thoughts about that?
So I'll give in full transparency, if you will, I'm political science undergrad, and it was one of those things that I was very interested in and still have, you know, some aspirations to be involved in some of it in the future, but I can't echo your sentiments any more than you have. I mean, we have to use our duties, especially, you know, in the places where we have the ability to vote. You know, we have to use our ability to use our voice in every way. So if you're not necessarily an entrepreneur or someone who can get out there and you know, walk through canvas neighborhoods and actually physically make change happen, well, at least use the vote, because things like, you know, expansion of certain services, Medicaid expansion, you know, happening or not happening in your state, in the United States, is going to impact, you know, the health and the ability of access to health for so many people. So these things are very important.
And see, we know that another thing that has really come to the forefront since COVID-19, which we've already known being in healthcare has been around forever too. You know, these rising costs of healthcare, which has affected the economic stability and have made a lot of households unstable from an economic standpoint. And this is one of the social determinants of health as well, economic stability or instability. And so you being a healthcare administrator, if you will, talk a little bit about how the cost of healthcare factors into the social determinants and what that process looks like behind the scenes, if you don't mind.
Right. So the cost is, there's so many ways. You see I'm stuttering here, Coach Gene, because it's so many ways I can go with this one. I mean, let's start with uninsured patients alone. So around in the United States, I know a little bit over 12% of the population is uninsured. Well, each uninsured patient on average costs, you know, $900 in an emergency room. Think about the amount of costs that adds up to that are now pushed onto the hospitals. The hospitals have to now offset, which will eventually end up, you know, down the line somewhere impacting tax dollars or something. So there are tremendous costs there. You also have to factor in the makeup of healthcare with insurance companies being in play. Right? So we get paid in healthcare different than typically just, you know, a regular transaction. You have to go through the insurance company. So that plays a factor in it as well. And contrary to a lot of popular belief, insurance companies don't want you in the hospital because it costs more. So the goal is preventative care. That's a little bit what the Hight Health does as well, is focus on preventative care. How can we keep people out of the hospital and keep people healthy? Because that's ultimately better for everybody in the long run.
Yes, that is so key. Thank you for bringing up that point, because that is what is going to drive down healthcare costs. And so for our listeners who may not be here in the United States, and we don't have universal healthcare like other nations do, right? And so you brought up a very valid point, Terrence, because the healthcare facilities, the organizations have to offset the cost of those who come into their organizations unable to pay, right? It raises our taxes, it raises our insurance premiums. They're going to get that money back some kind of way. And so the rising cost of healthcare, oh my God, you know, how do we offset that? You said it. We have to really invest in the health and well-being of individuals, of families, of communities, because that's what's going to drive down these healthcare expenditures. We want lower costs, right? And healthy individuals create healthy families, create healthy communities, create healthy nations, and a healthier world. And so, yes, we got to, you know, I always say people go on Google. We Google everything these days. But I don't think you can get enough health education and health awareness, Terrence.
No.
You know, the proper health education and awareness, because everything you see on Google is not necessarily, you know, bond. You know, back in the day, we used to say, my word is bond. It ain't. You might necessarily be able to take it to the bank and cash a check on it. You know what I'm saying? And so, what are some of the things that you do, your organization does, to help, you know, bring the awareness, you know, to the communities? I know y'all involved in a lot of health fairs and things like that nature.
Right. So that's definitely a great point you made about, you know, taking that word to the bank. So we're all about reestablishing trust, and that's why we try to be in the community. So like the health fair we had on the 31st in Forest Park, Georgia, that you were at, with the most popular table we had. So events like that, and going and showing our face and showing, hey, we're people in the community that are, you know, from various communities that have come together, and we're health professionals that look like people in these communities, and we can actually solve these problems in ways that other organizations can't. So our biggest thing is just, you know, saying, how do we at least provide access and access to the health services, and then awareness about the proper information, and then educate people on care, you know, at the same time, so we can reestablish that trust and get people healthier.
Right. And you know what's really, really becoming popular now, and again, I think because of COVID, we talked about the telehealth, and then these mobile, like healthcare on wheels, you know, those type of things. Yeah. The telehealth, I think, is here to stay, though.
Yeah, I definitely agree. And I definitely agree. I think, you know, we were forced forward into telehealth after last year, and we realized, hey, it actually works. There are some benefits. You know, people aren't just sitting in their pajamas all day, not doing anything. They're sitting in their pajamas doing stuff. So I think we realized that it worked. I think it's here to stay. And, you know, I think it's helped also bridge the gap in these rural areas where people don't have access to, you know, physicians. You don't have maybe 5 physicians in an entire city. You know, that's pretty difficult.
That's even if they have some type of facility, because here in Georgia, especially in a lot of the rural areas going further south of the Atlanta, they have closed several of the hospitals. Now, granted, they were community hospitals, probably no more than about 20, 30 beds. But when you're in a rural community, 30, 40, 50 miles out from a major medical facility or healthcare facility, that 20, 30 bed hospital matters, right? And so the transportation alone, so they closed a lot of these facilities. The government had stopped funding these facilities, stopped funding a lot of these public health clinics and stuff. My God, then we really need the telehealth. We really need these mobile on wheels services to go out to these areas to help decrease, you know, a lot of these determinants and causes that are preventing people from getting the health care that they need. So yeah, that is, man, yeah. Wow. And see that right there, that is another way that the government plays a role in it. It may be the county, local levels of government. But however, if you stop the funding into these communities, these rural areas, then you are contributing to these determinants of health, these social determinants of health. It may be a political determinant contributing to the social determinant.
Right.
And so that is key. I mean, provider availability, you brought that up. Less providers in a community, so that's decreased provider availability. Also, we know that every community is unique, right? And so I like Atlanta, like my hometown of New York, these melting pots of different cultures. And so both within healthcare facilities and outside of healthcare facilities, cultural competence and provider linguistics is key to helping to bridge the gap, And so what are your thoughts about that, and in your experience in healthcare administration, how cultural competency plays a role in these social determinants of health?
I absolutely agree, and it was something that I experienced, I guess, firsthand during a training. I forget which facility or hospital I was working at, but they explained to us that just because somebody is of Hispanic or Latino background or race doesn't necessarily mean that they can translate medical language. So something just as simple as, calling the translation line and getting an actual person who is certified in speaking Spanish as relates to the medical space. Something just that simple is a culturally confident thing. But I want you to think about how many times you probably seen that happen, which oftentimes, more times than not, you don't see that. You just see somebody finding someone to translate. So something just that small can impact, a language barrier can impact, care outcomes. So I definitely agree with what you're saying.
Yeah, and not just the language barriers, but how sometimes, we're talking about communication. So how in some cultures, and look, this is not a dig against doctors, right? But we have a society, conventional Western medicine is like, okay, this is my treatment plan for you, and this is what you're going to do. Many times, not all the time, but there are some instances to where the person, that individual seeking care, that they're not afforded buy-in into the plan of care or the treatment plan. And that can turn a lot of people off depending on what culture you are, or you're from, what your cultural background is, can turn a lot of people off as well. So, that's also included in cultural competency. And so when we look at the social determinants of healthcare as it relates to the healthcare system, all of that is really included in cultural competency and affects the quality of care, which in turn affects the health outcomes, mortality, morbidity, life expectancy, health status, healthcare expenditures, costs, and all of that. And so, I have a project that I just finished up that's going to be released next week, where I touch on this a little bit, how all of these factors, the economic stability or instability, education, food, access to healthier food options, the healthcare system, how all of this comes together and affects one's overall health and well-being. There has got to be, and you had some solutions, I know, and you talked about some the other day, and I love what you're doing. I love what your organization does, getting out here in the community, having the health fairs, but you got to get out there. We as leaders, particularly healthcare leaders in healthcare, healthcare organizations, it's key that we get out here in these communities, see what's going on, talk and communicate with the people, get their take on what, because no one knows what they need better than the people themselves within these communities, right? And so getting out there, asking the questions, having the conversation, and getting buy-in. for your opinion, how important is buy-in in helping to bridge this gap with these social determinants of health?
Buy-in is crucial, and that's because, again, we're dealing with people's health, and these are, people's lives, or at least, having some type of impact on it. So it's very important. So some of the things we're doing is our focus groups in the different areas, and focus groups that are focused on the different populations that we're targeting. So some are baby boomer focus groups, and some are millennial age focus groups, and so on and so forth. But by doing this, we'll be able to actually, again, to your point, speak with the community and hear the voice of the community, and then say, okay, as healthcare professionals, what type of resources do we have at our disposal? What type of government resources, so on and so forth, do we have to come in, meet with these community partners, and then bring these health solutions, to these areas to bridge these gaps.
And so let me ask you this. For our listeners who are live streaming and those who will catch the replay, from a healthcare administrator perspective, from your background, if someone was trying to, they're listening to us this week and they're recognizing that there are social determinants of health and pinpointing what they are in their particular communities, right? Because you're a military brat, and I say that with all due respect, and I'm retired military. We've been in places globally that we can pick any particular city overseas, and it will remind us of a city back here in the United States, right? Or a community back here in the United States. So for someone listening to us, what are some things that you would like? Where would they begin? Where would they start? Where could they start? And then from there, share a couple of key takeaways that you hope that they take from this episode this week. But where are some places that they can start? How do you start to bridge the gap?
Right. So I think the first thing comes from being informed and, finding that source of truth wherever you are. So if it's the World Health Organization or whatever the health, secretary site is, or the main health agency in your country or your state, really figuring that out and seeing, checking out the landscape and understanding, okay, what's going around and what are the actual issues? Because as you said, each different location has different determinants that's impacting it, more or less. So from there, I think once you're informed, then you'll be guided more towards, okay, do I need to go after primary care doctors or some type of physician? Do I need to partner with labs? Do I need to speak to people about blood donation? Maybe recycling is a thing that's needed here. Or maybe it's just environmental cleanup. And just kind of start where you are. Because I'm a big believer in, putting forth the effort, and then the stars will slowly align over time. So I definitely say that's how you can start. Just start with whatever local, source that you have. And then expand from there. As far as two things I'd say is takeaways, kind of be the same thing as the other day. One, if you're not vaccinated, then wear a mask. This virus is real. I've been speaking to colleagues daily that are scientists, epidemiologists, and physicians and health administrators. They're talking about the hospital. They're talking about the surge. Please wear a mask if you're not vaccinated. If you don't want to get the vax. And then the second thing is health is wealth. So I want everybody to just commit today to living a healthy lifestyle, and then connect with us, www.hight.health.
Amen. Thank you so much for sharing that and sharing your contact information. The bottom line is we've got to start somewhere. And those of us who are leaders in the communities, leaders in healthcare, to include, our faith leaders. So for you who are tuning in, if you are a pastor, a minister, faith leaders, this includes you as well. Because I will say this, and Terrence, my listeners know I'm very transparent. But look, and I just told someone this earlier today, church folks are some of the sickest folks I've ever seen. And it should not be that way. It should not be that way. Okay? We cannot represent whom we serve, nor his kingdom, all sick and weak and just tore up from the flow up. Okay? So, leaders, faith leaders, we got to get it together. we've got to be the example. I am the minister of health at my faith, where I fellowship at over the health and wellness ministry. And that's just something that is just so near and dear to my heart, because look, we've got to do better. We are leaders. We've got to be the change that we desire to see in others and throughout our communities. And that's just the bottom line. That's the world according to Nurse Coach Jean. Let me just say that, okay? That's my story, and I am sticking to it. Thank you very much.
I like it.
I'm just saying. So that's my soapbox for today. But these social determinants of health, for those of you who are tuning in, let's go over them. Economic stability, all right? Neighborhood and physical environment, which includes your housing. Oh my goodness, because some of this housing in a lot of our communities, people got to have a roof over their head, right, Terrence? But you got people that are living in conditions to where there's mold, and that is not conducive to health, right? And shame on the landlords and those people that are allowing that and not taking care of that situation, right? So our neighborhood and physical environment, can we please get more walking trails and more healthy food options, stores and restaurants in our communities, and stop with all the fast food? You know what? Here in my neighborhood and here in Atlanta, Terrence, let me tell you, in a 5-mile radius, I think we got 6 Waffle Houses in a straight line. Wow. Don't make no kind of sense. Like, it's stuff like that. You know what I'm saying? It's stuff like that. And I'm like, at our local community, county leaders, like, really? Do we really need another Waffle House in a 5-mile radius? Like, seriously, can I get a Whole Foods out here and stop having to go all the way to Cobb and Gwinnett County somewhere? I'm just saying. Another social education. Okay, I digress. Economic stability, neighborhood and physical environment, education, food, access to healthy options. Let's stop hunger. Community and social context. Our support system. Oh my God, support system is huge, right?
Yes.
We got to have support systems, right? If we don't have it with our family, hopefully in our social relationships outside of family, but we've got to have support systems, which include resources, community engagement, which we did talk about, Terrence, stress. Oh my God, we didn't touch on the stress piece. All of this lack. Look, inequities, determinants, inequalities, all lead to stress if not taken care of. We got to learn to manage our stress. Stress is another factor in this community when you put it in community and social context of social determinants of health. And last but definitely not least, our healthcare system. We got to provide the coverage. We got to provide providers, got to be available even in our rural areas. Our providers at all levels, all licensure levels, got to be culturally competent, and we've got to improve the quality of care. We talked a little the other day, and real briefly, I'm just going to mention it, because I am nationally certified in inpatient OB as a registered nurse in OB. That piece right there, because that has also been in the forefront of the news probably just before the pandemic, social determinants of health and healthcare and how it relates to the increasing, I should say, morbidity and mortality among women in their childbearing years. Any thoughts on that before we wrap up this week in the chat room?
No, that's something I'm glad that there's more awareness being brought to that. Seeing people, and these women, so young, African American women are so young that are dying during childbirth, prior to childbirth or after childbirth. So I'm glad there's more awareness being brought to it, and hopefully that's something that can be jumped on, pretty fast.
Yeah, we definitely. And you talking about health. I mean, yeah, we got to do something about that. But that was just another issue that has come to the forefront. I want to say increased awareness since the pandemic, but actually probably about a year or two prior to the pandemic, we've been noticing an increasing trend. And again, goes back to these social determinants of health. And so, look, Terrence, I want to thank you so much for taking time out of your busy schedule to join me here in the chat room, Health Chat with Coach Jean Global Podcast. Look, any final thoughts before we wrap up this episode?
Just Coach Jean, it was my pleasure. Again, just hope everybody stays healthy, stays masked up and vaccinated at this point. And, health is wealth.
Health is definitely wealth. And I'll also say health is part of our success. And for those of us, because sometimes, Terrence, we get so busy, caught up in the grinding, moving and shaking and grooving and juking and jiving, as the old folks used to say, and, trying to be successful, whatever success means to us, because it means different things to different people. We got to realize health is our wealth, and we can't be successful. We can't do nothing without our health and strength. So I thank you so much for ending this episode here in the chat room with that very important fact. Health is wealth. So thank you once again to you, my friend. I will be in touch. I want to give a shout out to our listening audience, both here in the United States and around the world. Thank you so much for tuning in to another week here in the chat room, Health Chat with Coach Jean. I am your girl, Nurse Coach Jean Turner, here in Atlanta, Georgia, USA. A very special shout out to my producer, the Batman of Charm City, Mr. Jerry Royce Live himself, and the entire Positive Power XXI crew. Look, y'all up there in the thick of Ida, be safe. And look, I wish you all peace and health. And don't forget, follow me on Facebook and Instagram and Health Chat with Coach Jean. If you are on LinkedIn, follow me at Nurse Coach Jean. And if you are in the house, Clubhouse that is, follow me, Jean Turner, at Nurse Coach 63. And you can always go to my website, www.spiritofawarrior.life, and allow me, Nurse Coach Jean, to help you excel on your wellness journey so that you can reach your maximum wellness capacity and be the healthiest version of you that you can be, body, mind, soul, and spirit. And so until next time, if God says the same, deuces, peace out. Thank you so much. Good night.
Thank you for joining us for another episode here in the chat room. Health Chat with Coach Jean, that is. Until next time, if God says the same, I pray peace, health, love, and well-being for you and your family. God bless you.
You are listening to Jerry Royce Live Worldwide Podcast.